Ann Jones is a retired registered nurse, having earned a bachelor's degree at the University of Minnesota and a master's in health and human services from St. Mary's University. She spent 45 years in nursing, mainly at the University of Minnesota, working in medical, surgical nursing, intensive care, clinical education, and nursing leadership. And also served 23 years in the U.S. Air Force Reserve as a flight nurse. Thanks for your service, Ann. She has now turned a long-standing interest in health policy into advocacy for a single-payer solution, serving as Vice Chair for Healthcare for All Minnesota and Chair of the Education and Outreach Committee. And Ann Jones is the Energizer Bunny of Minnesota healthcare, believe me. Ann is going to tell you about the fascinating events, and some of them are pretty sad, that eventually led to the enactment of Medicare. And I say sad by the fact that it took so long. So take it away, Ann, and I will get you started.
Okay, thank you. Forgot to mention my stint in the operating rooms. I spent quite a few years in the OR. That's where we really know how to spend money, and that's where I met my friend Erin. Okay, so many of you will recognize this iconic photo. By the way, Dave gave me 10 minutes to tell you the story of how Medicare came to pass. I'm going to try really hard. Might be 11. The Medicare and Medicaid Act was signed into law in Independence, Missouri by President Lyndon Johnson on July 30th, 1965, also known as the Social Security Amendments of 1965. The First Lady is in the photo to the president's left. Behind her and to our right is Vice President Hubert Humphrey of Minnesota. On the right side of the photo is former President Harry Truman and Bess. Approximately 17 years after Harry Truman's unsuccessful attempt to pass a national health plan, President Johnson enrolled Harry Truman as the first Medicare beneficiary. All of these programs are so linked that it's hard to talk about one without the other. The original documents from that day are now kept in the National Archives in Washington, D.C. This is just, if you get the slides from this day or see the or get access to the video, which we are recording, this is a brief description of some of the legislation that has been passed, proposed, and some of the factors that lead to our current healthcare crisis at the national level over the last 100+ years. So the point is, this is not new. We've been trying to fix this for over 100 years. To appreciate the enormity of passing Medicare and Medicaid, we have to go back at least to this event. President Franklin Delano Roosevelt signed the Social Security Act into law on August 14th, 1935. Behind President Roosevelt is Labor Secretary Frances Perkins, the first woman Secretary of Labor and the first woman to serve in a cabinet position, whose agenda is reflected in most of the New Deal legislation pushed by FDR and passed during the depths of the Great Depression, and we are feeling her influence today. FDR left health insurance out of the bill, mostly to get other benefits to workers more quickly. And Social Security also was not as comprehensive as it is today. It's improved. Even so, Republicans opposed Social Security from the start and promised to overturn it, and nothing much has changed. The mere mention of national health insurance at this time as part of a broader social insurance agenda led to the first special meeting of the House of Delegates of the American Medical Association, who immediately flooded members of the Ways and Means Committee with telegrams protesting this nefarious plot for a compulsory health insurance. The GOP and private medical organizations piled on and campaigned against this, even the mention of national health insurance. FDR considered making national health insurance a campaign issue in 1938, but left it to the 1940 presidential campaign. Then World War II intervened. 4 years later, FDR had been reelected to an unprecedented fourth term. The country was still at war. The president delivered his State of the Union address to the nation from the White House that year over the radio on January 11th, 1944, which included a second Bill of Rights in which he named defined medical care as a right of all Americans. He said individual freedom cannot exist without economic security. In his final State of the Union address in January 1945, FDR pledged to communicate with Congress regarding expanded health security programs, and 3 months later, President Roosevelt had died. Vice President Harry Truman assumed the presidency and took up a progressive agenda immediately. In September, he announced plans for the Fair Deal, which included extending and expanding and improving our entire Social Security program. Bills proposing a national health program were introduced in the Congress, but by 1946, Republicans had regained majorities and those bills went nowhere. Truman won the presidency on his own in 1948. Democrats had retaken the Congress, but subsequent attempts to pass a national health plan were plagued with accusations and fears of communism as the Cold War settled in, and ongoing opposition from the GOP and, again, the AMA. I encourage everyone, if you can, to read this book, Medicare for All, A Citizen's Guide, where about the first third of the book is about the struggle to get national health insurance and to get Medicare passed. It's really an excellent summary. Their campaign was joined, the opposition was joined by a coalition of wealthy interests, including insurance companies, pharmaceutical companies, and big business, who published pieces opposing a national health plan and took out ads calling national health insurance the enemy of free enterprise. Public support dropped, and Truman left office without expanding health care. They had succeeded in stopping any such effort for more than a decade. It would be easy to assume that, of course, we would have some sort of health insurance and health security for the elderly, just like Social Security provided old age income security. Because show me which insurance companies are fighting to cover old people and sick people and disabled people. So of course the government had to step in. Well, you would be wrong. Getting Medicare and Medicaid passed was a huge fight that required massive public support and activism against fierce and well-funded opposition by the same forces that had opposed a national health plan years earlier. With national health insurance as the long-term goal, reformers decided to focus on hospital insurance for seniors, believing that this would be the first step toward national health insurance. President John F. Kennedy made this a key part of his successful presidential campaign. Kennedy was a popular president, and Democrats had large majorities in the Congress at this time. Public support was again high. However, JFK encountered the same opposition as Truman had, including conservative, mostly Southern Democrats in the Congress. Then, in 1963, Kennedy was assassinated. Corporate interests, the GOP and the AMA, mounted organized and open opposition to Medicare, as did conservative Democrats in Congress. Southern Democrats did not support social programs that covered persons of color. The AMA fought Medicare with all the tactics they had used to oppose national health insurance in 1948 and went on an all-out campaign to defeat it. They raised money, hired public relations firms to lobby against it, deployed speakers, printed pamphlets, met with the press to get their opposition in print, posted ads in offices, and more. Doctors' wives even held coffee parties in their homes across the country where they played this anti-Medicare recording. In 1961, the AMA had hired movie actor and radio personality Ronald Reagan to make ads specifically opposing Medicare. He famously recorded this statement, again calling up the specter of socialism. In August 1964, busloads of retirees attended the Democratic National Convention in Atlantic City, representing the National Council of Senior Citizens, organized and funded by the AFL-CIO, to make their case for the need for public health insurance. This was not a top-down movement. This was grassroots support, was and is the key. The NCSC held letter writing campaigns, contacted media and elected officials, printed brochures to counter the propaganda being put out by the medical lobby and other opponents. They worked out of a small office, very busy office near Capitol Hill. They testified before Congress, visited their offices, while seniors all over the country turned out for campaigns and worked to elect Democrats who would support Medicare. Members of Congress in the day said those seniors were everywhere. They faced down opposition from corporate interests and the AMA. It was a David and Goliath fight then, and it's the same today to finish the job of getting to single-payer Medicare for all. 1 year later, this kind of activism had won and remains today the closest thing we have to an entitlement for health care, at least for those over 65 and low-income Americans, if we can keep it. The bill that eventually passed was crafted by Representative Wilbur Mills, a longtime opponent of Medicare, and involves a compromise with 3 parts. The Democratic proposal for Part A is hospital insurance under Social Security. Medicare Part B, proposed by Republicans, covers physician services, and Medicaid, a state-run program for the poor, was the proposal of the AMA. This bill was a huge success. President Johnson would go on to use Medicare to desegregate America's hospitals by pledging to withhold federal funds for Medicare patients unless the hospitals conformed. And just a few words about Medicaid, which is medical assistance in Minnesota. Medicaid is the largest health insurance program in the country. Current numbers for 2023, 93,876,834 individuals were enrolled in Medicaid and CHIP, the Children's Health Insurance Program. Prior to COVID-19, that number was around 71 million. 1 in 5 persons in Minnesota depend on Medicaid, and this includes urban, suburban, and rural Minnesota. Of the 1 in 5 in our state who depend on Medicaid, almost half are children. Almost 70% of Medicaid spending is on seniors and the disabled in nursing homes. Post-COVID-19, Medicaid eligibility for millions of people around the country ends, and the numbers of uninsured and underinsured will likely go up. One of Healthcare for All Minnesota's legislative priorities is to remove the costs and control imposed by a decision made over 30 years ago to contract with the commercial health insurance industry to administer our public insurance programs here in our state. The single-payer movement is trying to sound the alarm about threats posed by privatizing Medicare, which started in the 1970s and has reached an alarming stage in which, if not stopped, could be the end of Medicare as we know it by 2030. And that's just my contact information for the slide.